Merry Christmas and Happy New Year. We are starting the new year off strong because today I have a really exciting interview for you. Today I interview a woman named Dr. Margarite Duane. She is the founder of an organization called FACTS About Fertility. And this organization's goal is to teach doctors and med students about fertility awareness-based methods, or NFP, and how they can be used to treat women who have reproductive issues. And it's just such a fascinating interview. I learned so much from her just in the 30 minutes we were able to spend together, and I know you will too. So if you are interested in learning more about how you can better medicine without using the pill and with using fertility awareness-based methods, NFP, charting your cycle, please stay tuned. Welcome to the Truth and Fertility Podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created and how it should be working and the best medicine in order to make it work if it is not, you are in the right place. I pray that this blesses you. So let's get to it. Well, Dr. Duane, thank you so much for being here today and for agreeing to this interview. I'm very, very excited to pick your brain about this topic, which is fertility awareness-based methods or natural family planning, and why this is a very good tool for medicine and for women's healthcare. So before we really dive into that, can you please just give a quick introduction of yourself, facts about fertility, your organization, and all of that?
Great. Absolutely. And thank you so much, Haley, for the invitation. I am delighted to be here as part of your Truth and Fertility podcast. So a little bit more about myself. My name is Dr. Margarite Duane. I am a board certified family physician, co-founder and executive director of FACTS About Fertility. FACTS stands for the Fertility Appreciation Collaborative to Teach the Science. And our mission is focused on educating the medical professional community, physicians, midwives, nurse practitioners, residents, and students about the science underlying natural or fertility awareness-based methods, their role in women's health and the medical applications, as well as the effectiveness of these methods for family planning. And FACTS started after I had the opportunity to teach a small group elective at Georgetown University School of Medicine, where I'm an adjunct associate professor. And I recently just assumed a position at Duquesne University as an associate professor as the director for the Center of Fertility Awareness Education and Research. So all of my work is really centered on sharing the science, educating my medical colleagues with the best evidence underlying the important role female cycle tracking or charting the female cycle plays in health monitoring and managing a wide range of health conditions that impact not only women, but couples. So thanks again for the invitation to be with you today.
Yes, absolutely. Well, thank you. For just really quickly, I know this is a really loaded question, but can you just explain how you can chart the female cycle, how you can use fertility awareness-based methods for the sake of medicine? Because I think that a lot of people, when they think about that, they really just think about it for family planning, which is also amazing in and of itself. But how can it really be used to also be used in medicine and even treat reproductive issues?
Yeah, great question. I think I'll start with an important thing to note is that both the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics recognizes the female menstrual or ovarian menstrual cycle as a fifth vital sign, because when a woman learns to chart what we refer to as observable signs or biomarkers that reflect her internal hormonal changes. This provides a daily diary of what is happening within a woman's body. There are really three key signs that a woman can learn to observe. She can not only track when her period begins, and just a quick note, we call the period because it actually marks the end of the previous ovulatory cycle, right? So the beginning of the cycle actually begins after the period ends. Typically, a woman in the first few days after her period ends will note dryness. She won't actually note any significant symptoms. If she's tracking her basal body temperature, which is one of the signs she can track, it tends to be a little bit lower. But as a woman's estradiol levels begin to rise prior to ovulation, this acts on the cervix to produce a type of cervical fluid secretions or mucus that is an indication that her fertile window is opening. As ovulation approaches, once a woman hits ovulation, she has a release of her LH hormone, which triggers ovulation. Women can detect the rise in estradiol and the surge in LH hormone by tracking urinary hormones or urinary biomarkers. Once ovulation has occurred, a woman's basal body temperature will actually increase by about a half a degree. And so these are the three key signs that women can learn to observe: her cervical fluid secretions, her change in basal body temperature, and her urinary hormone measurements. All three of these signs, again, reflect internal hormonal changes. So as I say to a woman, when you chart your cycle, it provides a daily diary of external signs that reflect the internal hormonal changes that are happening in your body. Now, hopefully we're going to see normal, healthy, regular cycles, but sometimes we don't. Sometimes women have lots of cervical secretions all throughout the cycle. That's a sign that something is off with her hormones. Sometimes she may have a very low basal body temperature, or she doesn't have a shift in her basal body temperature. Again, that's a sign that there may be something affecting ovulation. Sometimes women will note abnormal bleeding. Perhaps she'll note spotting 2 or 3 days before her cycle. Again, this shows me as a physician trained in these methods that there may be underlying hormonal abnormalities. I then use this information to target the workup, the laboratory testing and imaging studies that I may do, and more importantly, target the treatment to address the underlying causes. So again, charting the female ovarian menstrual cycle really provides a great deal of information to doctors like myself that are trained in restorative reproductive medicine, giving us the information that we need to actually diagnose and treat the underlying root causes of a wide range of women's health issues.
Okay. Thank you so much for that explanation. That was great. I guess my next question really goes into, why is this not as well known then? Because you're explaining all of these amazing things about how our hormones will change throughout our cycle and how we can actually see external biomarkers that show us if these hormones are in proper balance or if they're not. And it sounds like very good medicine. It sounds like the most healthy thing that you can do, really, to truly diagnose and treat. And so why is this not as well known or more practiced by doctors and specifically OBGYNs?
Yeah. Again, another great question, and a question that the students asked me the very first year I taught this class at Georgetown. The first year medical students, their response to the course was, "This is the most clinically relevant information I've learned all year. This is the most applicable to my own life. This is basic reproductive physiology."
Right.
And one student said, like, "This is something every medical student should learn." And I thought to myself, you're right. This is something every medical student should learn. And it was that feedback that really motivated me to begin FACTS, because the elective that I was teaching at Georgetown was the only elective of its kind. We started in 2010, and to this day, it is still the only elective or course that is regularly taught through a medical school on this topic. The great news is we're now teaching it at nursing schools as well, and our elective is open to any healthcare professional student. And in the last decade, we have had over 1,000 medical and nursing students learn this information. But your question is, why is this not routinely taught? And the reality is that for most women, you actually don't need doctors to be able to use these methods effectively. Women and men, when they're learning to chart their cycle, especially from a family planning perspective, should learn from trained instructors, whether they're trained fertility care practitioners through the Creighton model, trained Marguerite instructors, trained in Sympto-Thermal. These are people that do not necessarily have to have a medical degree, but they're trained to teach this very important information. Teaching a woman how to chart her cycle takes time, and it takes longer than most doctors have in a 10 or 15-minute office visit. Certainly, most OBGYNs don't have the time to sit and explain this. It's much faster and easier for them to write a prescription for a birth control pill, or it's more lucrative for them to place an IUD and bill that as a procedure, and they can, generate a lot more revenue than taking the time to teach this information. Until very recently as well, these methods have not been covered through health insurance. In fact, when Health and Human Services passed the birth control mandate to provide birth control for free under health insurance, it did not actually include natural or fertility awareness-based methods of family planning. And so women could not get this covered through their health insurance. So it's not routinely taught in medical schools because it's not something that doctors need to be able to teach women how to chart. But doctors do need to learn to be able to read the female cycle chart and interpret it. And in fact, we teach medical students to read the female cycle chart like they read an EKG. They go through it in a very systematic, standardized way. Unfortunately, though, taking the time to chart, taking the time to use the chart to aid in the diagnosis, and then using that information to target your treatment is more time intensive and frankly less profitable than, simply writing a prescription for hormonal birth control. And, the reality is most physicians, OBGYNs included, don't necessarily have the time or want to take the time. So I think that's a big part. It's the time, it's the financial incentives. And I think, a third reason, and this is somewhat the elephant in the room, for the longest time, natural or fertility awareness-based methods, and to be clear, I use those terms interchangeably, natural family planning, fertility
Sure.
awareness-based methods.
Yeah.
The key difference is natural family planning focuses on the use of charting from a family planning perspective, whereas fertility awareness-based methods highlight a much broader applications. But the term natural family planning was actually first coined in the 1970s by the National Institutes of Health, right? So a government medical organization. But the reality is in the 1970s, the organizations that were primarily promoting the use of natural methods were faith-based organizations. And I think a lot of people within the medical community associate natural methods of family planning with conservative, orthodox religious organizations, whether it's Catholics, Muslims, Jews. And so they tend not to think that this is for everyone. In fact, my own personal belief, I like to say, nobody's ovaries are Catholic. Like, these methods should be made available to every woman, every female, so that she can really learn how to chart her cycle and be empowered with this information to care for their health. So again, I think those are the primary reasons: lack of time, lack of funding and support, and the faith-based nature aspect of it, and that it has been primarily promoted up until the last 10 years through faith-based organizations. But again, in fact, our focus is on sharing the science with all healthcare professionals so that, we can educate our colleagues to in turn educate and empower women and really engage men in the conversation of family planning again.
Okay, well, thank you for that. I kept thinking as you were speaking, I understand that it is very time consuming, especially as an instructor of 6 or 7 years now.
Yep.
I can understand that for sure. But I will say, though, most doctors don't, at least in my experience, don't even have a whole lot of knowledge about this topic, even just about the natural hormones and how they're supposed to be, because so much of the time it's just they give you the pill if you have irregular cycles or painful periods or and it's just, okay, here's the pill. And in my experience, actually, I have a whole journey with PCOS and coming to healing with that. And at the beginning of my journey, when I was seeing a doctor who was not familiar with fertility awareness-based methods, she actually asked me, she asked if I wanted the pill, and I said no. And she asked why. And I said, well, because my issue is that I don't ovulate and I want to ovulate because that's what a healthy body should do. Now, I was single. I was not married. I was not trying to have a baby at the point at that time. And she looked at me and she said, well, why do you want to ovulate? And that to me, just, it like completely rang a bell in my head. I was like, oh, okay, this is a completely different mindset than what I need in a doctor. So and this is a smart woman, right? She went through
Yeah.
medical school. She knows her stuff, but there seems to be such a disconnect there. So why do you think that is, that even in medical
Yeah.
school, the basics of this is not even taught, let alone just how to chart the cycle, but even just the basics of how a healthy women's reproductive system should go?
Right. Again, really fantastic questions. And you made a really key point that I want to drive home. Ovulation is a sign of health. In order for a woman to ovulate, to release that egg once per cycle, it requires an intricate orchestration of her hormones, not just the estradiol and the progesterone, but even further up, in the gonadotropin releasing hormones, her thyroid hormone, her prolactin, like all of her hormones have to be operating um, optimally in order for a woman to ovulate. And ovulation is a sign of health. Unfortunately, as you noted, most doctors do not learn that very fundamental, foundational fact that ovulation is a sign of health. And I think part of it is that for the last 60 years, hormonal birth control has been available and it has served as an easy, quote unquote, solution. And we haven't really come to fully appreciate the important roles of the female hormones. I mean, estradiol and progesterone are the key reproductive hormones, but they play a much bigger role than just reproduction. Estradiol is really important for heart health. It's important for energy. Progesterone is really important for bone health. It also serves as an anxiolytic, meaning that it helps women to be more calm, which is why we see in conditions like PMS, premenstrual syndrome, where women may experience a lot of anxiety, irritability. It's often due to the fact that their progesterone levels are dropping too rapidly. And yet we don't fully learn this as medical students. We don't learn about all of the different roles of estradiol and progesterone. And in addition, we often learn that synthetic estrogens and synthetic progestins are the same, quote unquote, as estradiol and progesterone. But to be clear, synthetic hormones that are found in hormonal birth control or hormonal IUDs or pills or patches are not the same as the bioidentical, the estradiol and progesterone that the body naturally produces. And the reality is we simply don't learn this. And when you talk about something like polycystic ovarian syndrome, which is a very, very common condition, it affects, 10 to 15% of women. It can result in irregular cycles. If you look at the medical guidelines for treating a woman with PCOS, the first line treatment is hormonal birth control. The problem is to your point, it doesn't actually treat the underlying issue, which is anovulatory cycles, right? And it doesn't actually give women a regular cycle. It gives women a regular withdrawal bleed, but it is not resulting in ovulation. And in fact, it can often exacerbate or worsen the things that is causing the anovulation, such as insulin resistance, which we commonly see in PCOS. Insulin resistance is another very, very common cause of anovulation. And hormonal birth control can actually worsen the insulin resistance. So giving hormonal birth control may seem like a solution, and but it's really a band-aid that covers up the underlying issues. Again, another common symptom that women often come to the doctor with, they present to their OBGYN with, is painful periods, right? Painful periods are very common. And the most common underlying cause of painful periods is a condition called endometriosis. And in the United States of America, again, endometriosis is very common. Endometriosis and PCOS, the two leading common causes of infertility in women. But with endometriosis, the common presenting symptoms are either painful periods or infertility. Yet in the United States of America, where we have arguably one of the best healthcare systems in the world, it takes women on average from the onset of symptoms to the time of diagnosis of endometriosis about 10 to 12 years to get a diagnosis. Now, for those of you who aren't familiar with endometriosis, it can often cause such painful, debilitating periods that it leaves women curled up in a ball for 2 or 3 days, sometimes vomiting, sometimes experiencing severe abdominal symptoms that can be, significantly impact the quality of life. And it doesn't happen 1 month, it happens month after month year after year. And when I give talks to men, I'm like, men, how many of you would put up with that? How long would you put up with that before you go to your doctor and say, I demand a diagnosis and a treatment? Now, endometriosis is commonly treated, quote unquote, with hormonal birth control. And hormonal birth control can suppress the symptoms of the pain. So it makes it seem like the condition is being treated. But again, the underlying condition will often worsen. I have a brand new patient in my practice who's 40 years old who is struggling with infertility. And from the time she was 15, she was put on birth control, and she's been off and on it for 15 to 20 years because of painful periods. She never actually received surgery, which is what is necessary to diagnose and treat endometriosis, until she was in her late 30s. This does a huge disservice to women. And I want to give grace to my colleagues, to my medical colleagues, if any of them are listening. I know what it was like to see women with irregular cycles, and you want to help them, and the birth control pill seems to help, or the woman with painful periods. You know, I was one of those women in college who was given birth control for painful periods and thought, okay, well, this is my only option. Now that I've learned everything that I know, I realize we can do better. We can provide better health care for women. And to do that, it is going to be more time intensive, right? I mean, something like, similar to obesity, like you can treat obesity by doing surgery, but the better solution is actually changing the diet, increasing the exercise. It's just more time consuming and does require more commitment, just like charting the female cycle and getting at those root causes by using that cycle chart as a diagnostic tool and working on the necessary changes, whether it's dietary changes in PCOS or surgery and endometriosis, to really treat the underlying causes. And personally, as a physician, I encourage my colleagues to learn more. I empathize with the fact I didn't learn about this in medical school. I just happened to be fortunate enough as a resident to have a senior resident who knew this information and shared this with me, and it changed the way that I practice medicine. And I stopped reflexively prescribing birth control for every woman's health complaint because I realized this wasn't good health care. And at FACTS, our mission is to educate as many medical professionals, family physicians, OBGYNs, midwives, to apply these protocols to actually better treat women's health issues.
Okay. Yeah. And that just makes so much sense as to why you would want to take that time and maybe even less profitable approach, because it really is true and good
Yes.
medicine
Yes.
rather than, giving the pill. Now, my next question then is, maybe just even speaking of your experience, how often do you see women later down the road, like you were just saying with this 40-year-old women that you're treating, who have been put on birth control for years and years and years and are now struggling with infertility and are now struggling with other symptoms, other unwanted symptoms? How often does that happen now because of the pill and that being more of a quick fix rather than actually getting to the root cause?
Yeah. Again, a really, really great question. And I will say I see it a lot. Hormonal birth control, again, we often think of hormonal birth control as solely acting on the reproductive health system, but it doesn't. The synthetic estrogens and progesterone affect a woman's body overall and causes side effects in almost every system of the woman's body. It can cause mental health issues. There's good research coming out of Denmark, huge studies looking at significant increases in risk of depression and suicide, especially among adolescents. Depo-Provera can cause significant effects on bone loss and also increase risk for osteoporosis. Again, with in terms of infertility, there's research out of Sweden by Dr. Erik Odeblad that looks at the effect of hormonal birth control on the cervix. And I talked about in the beginning, cervical fluid is an important biomarker or sign that women can observe, but it's also critically important for sperm health and sperm survivability to allow for fertilization to occur. When women are on hormonal birth control, it actually ages the cervical glandular cells, such that if a woman is on hormonal birth control from the age of 15 to 30, she doesn't have the cervix of a 30-year-old, she has the cervix of a 45-year-old because of the synthetic hormones' negative impact on the cervix and the cervical glandular cells. Hormonal birth control, the combination hormonal birth control pill, is also classified as a group 1 carcinogen because of the increased risk of breast, cervical, and liver cancers. So there's significant risks associated. You know, my own personal experience, again, I was one of those women in college presented to the doctor with painful periods for 1 or 2 days a cycle, but at times was debilitating. And I remember having, not done well on a biochemistry midterm because I happened to get my period that day and was in a lot of pain. And so I thought I needed to do something. Hormonal birth control was the only thing that was offered. And I explained, like, I wasn't sexually active. I didn't need it for birth control. My painful periods only were 2 days a cycle. Like, did I need to take a pill every single day? And I was told that this was the best option. And so I took it. But I also experienced side effects like many women. And in my case, I experienced significant hair loss, and it was a major concern to me. I ended up going off the pill and found other ways to manage my symptoms that did not have the extent of the side effects. But when it comes to using hormonal birth control to treat PCOS and endometriosis, again, these are the two leading causes of infertility. You're not actually treating it, and you're actually in some cases allowing the disease to progress such that there is increases in fertility. And I can say in the last 15 years since I have done this work, the infertility rates have gone from 1 in 8 couples to now 1 in 5 couples experience infertility. And I have no doubt this is due in part to the delay in the diagnosis and treatment. The delays in diagnosis and treatment also leads to women and men waiting longer or trying to have children at a later age. I mean, it's much harder to have a baby at 40 than it is at 35 or than it is at 30. So, at FACTS, our philosophy is, we want women to be aware of all of their options, and we want them to have full informed consent about how different methods of family planning work, their effectiveness from a family planning perspective. And I like to say fertility awareness-based methods are actually the only true methods of family planning, because you can use them not only to help prevent pregnancy, but also to help achieve pregnancy, both in couples with normal fertility and in couples with subfertility. Whereas conventional forms of family planning, quote unquote, really are methods of birth control or contraception in that they prevent pregnancy. They're not actually helping women to get pregnant. So there's a lot to it. And again, really, really great questions. We encourage people to learn more, to educate themselves on our factsaboutfertility.org website. Our mission is to share the science and really inform yourself so you can make a true informed choice, not only about the effectiveness of methods, but the side effects. As I said, FABMs are the only true forms of family planning. They're also the only methods of family planning without any medical side effects, because they do not do anything to disrupt, disable, or destroy the reproductive health system of either the woman or the man. So again, it's important for people to really do their homework. And if you're having difficulty finding a doctor, I mean, I know you mentioned your experience with a doctor. It is hard. There are still so few doctors that are trained in this, but at FACTS, we do have a directory of physicians, clinicians, and educators that are trained. And all of this information is found on our website, factsaboutfertility.org.
Okay. And kind of steering into facts about fertility, what does that, you mentioned you have an elective for medical students. So what does that elective look like? Exactly what is it teaching? And just kind of give the basics of what that elective looks like and how its mission into teaching medical students about this to really better their medicine.
Sure. Yeah. So the FACTS elective is the cornerstone program of Facts About Fertility. Again, it was teaching the elective in 2010 is what inspired me to form FACTS. And in 2018, we had it officially approved so we could offer it to medical students at any medical school. And we've had medical students from over 100 different medical schools all across the United States, and in fact, all across the world. We've had students from Australia, from Israel, from England, from Bangladesh. I mean, it's been incredible to see the interest. It's a 4-week elective. It's divided into 2 parts. The first part, Part A, focuses on fertility awareness-based methods for family planning, where we provide an introduction to all of the evidence-based methods: Billings, Creighton, Sympto-Thermal, Marquette, Standard Days, lactational amenorrhea method, and their effectiveness from a family planning perspective. We talk about miscarriage and addressing modifiable risk factors for miscarriage, how we can prevent miscarriage, couples who have experienced multiple miscarriages, really trying to address that. We address infertility. We also look at the psychosocial aspects of miscarriage and infertility to address that, because that's a huge aspect that affects women. Part B of the elective focuses on the medical applications of fertility awareness-based methods, and we look at common conditions like abnormal bleeding, anovulatory cycles, dysmenorrhea or painful periods, PMS. We look at using these methods in different patient populations, in the adolescent population, in the postpartum population, as well as in the perimenopausal population. And our elective is extremely popular. I mean, I think we're probably close to being full this academic year. We might have a few more spots left in our May block. And in recent years, we've had more clinicians, doctors, midwives, nurse practitioners reach out and say, hey, can I take this course? And we do have a limit on the number of people that can take our electives. So we've now actually launched an online continuing medical education course that is open to every medical professional and even fertility educators and people that are interested in learning more. Our online continuing medical education course currently has 10 parts. We will be expanding it to 13 parts. This year, people can sign up for one or more parts. If they are a member of FACTS, and again, we've got professional memberships, associate memberships for those that are not clinicians, and student memberships. If people are members of FACTS, they can get a significant discount on the CME course, as well as on FACTS conferences. So FACTS now offers conferences. We're doing an in-person conference. We're doing two upcoming in-person meetings or conferences. On February 27th, FACTS will be in Florida, in Orlando, Florida. We're doing a mini meeting, a half day on Thursday afternoon, February 27th. This is actually going to be a pre-conference to a larger OBGYN pediatric meeting in Orlando, Florida that weekend. And then in March, FACTS will be doing a conference with the theme New Horizons in Holistic Women's Healthcare. That conference is going to be March 21st and 22nd at Duquesne University in Pittsburgh, Pennsylvania. And then every year we also do a virtual conference, which we typically will do in the fall. We don't have the date set for that this year, but there's lots of opportunities, whether you're a medical professional, a student, or simply a fertility educator, woman or man, interested in learning more about this topic. Our goal is to share the facts about fertility, again, to educate and empower both the medical and general communities.
Wow, thank you. You said, I actually thought it was only for med students, which I am not. And so you said fertility educators. I'm like, ooh, maybe down the road, that would be something I would enjoy doing, because this topic is just, you barely just scratched the surface. I mean, there's so much that goes into just this better way of doing medicine for reproductive health and just fertility. So
absolutely.
Dr. Duane,
there's so much. And again, the elective is for medical or other health professional students,
sure.
Nursing, midwifery students, even pharmacy and physical therapy students have taken the course. But the online continuing medical education course is open to anyone and everyone that is interested in learning more. It's geared towards a medical audience, but certainly most fertility educators will really glean a lot of information. And it's divided into different topics. We have a section on fertility and femtech, one on lifestyle, the effect of nutrition, exercise, and sleep. Again, different medical applications. So lots to learn and lots of options for people that are interested.
Yeah. Well, Dr. Duane, thank you so much for being here on the Truth and Fertility podcast. I really appreciate your time. Do you have any last words or anything else that you would like to include or add?
No, I just thank you so much for the opportunity. Again, if people are interested in learning more, we invite them to visit our FACTS website, factsaboutfertility.org, and they can also email us at info@factsaboutfertility.org if they're looking for more information. And I will just say, for those that are members of FACTS, so if that's something that you're considering, we do a monthly Community Connects event the second Wednesday of every month. So it's a great opportunity to get to network with others that are passionate about this topic and to learn about opportunities for more education, research, and even just where to help people get the care that they need when it comes to fertility and restorative reproductive medicine. So our next Community Connects event is January 8th. And again, it's always the second Wednesday of every month for FACTS members. So visit our factsaboutfertility.org website and click on join if you're interested in becoming a member, and email us if you have questions. Thank you.
Well, thank you so much. Have a great rest of your day.
Thank you.